Hello, I'm Dr. Graw, founder of Righttime Medical Care, and this is your apple per day. Now that spring is upon us, we're here to talk about allergies. Springtime allergens are the principal cause for outdoor allergies. When the first blossom occurs on a tree or a flower erupts, there are those of us who are very allergic who begin to see those symptoms. They can continue through the summer when the grass pollens erupt and into the fall with ragweed, not to stop until there's a first hard freeze of winter. Unlike the winter allergens, which we've talked about, including dust, dust mite, and mold, spring allergens are associated with tree pollen and flower pollen. Those are the irritants that cause the symptoms which we've described before. Spring allergies are pretty easy to recognize. They're the sneezy, itchy, scratchy symptoms that we all know. Most people complain of their eyes, a little bit of itching, a little bit of burning, a little bit of sniffing, a lot of sneezing, a lot of nose scratching. You see people go like this. This is the allergic salute. If you're living in the house with somebody doing this, you can say, "How are your allergies doing?" They even sometimes develop a crease right across the nose or dark circles under their eyes because there's so much congestion. Allergic symptoms: eyes, nose, throat, itchy throat, wheezing, coughing, and sneezing are associated with springtime allergies. When the symptoms persist and we're not improving with those home remedies, over-the-counter antihistamines, and prescription eye drops, it's time to visit a physician. What will the physician do? Well, if your symptoms are bad, they'll try to determine which allergen is creating the problems. Is it a particular kind of allergen from an early spring blossom, a grass pollen, or ragweed, or all of them? How will they do that? Sometimes using skin prick testing, and other times using complicated but very modernized and easy to interpret blood tests. Once those are determined, the #1 treatment for allergens is avoidance. They may tell you, "Why don't you move to another part of the country?" You know, that's not practical, but clearly avoidance of the allergen is the most important part of treatment. Secondly, they may recommend testing and evaluation of an allergy shot regimen. They'll describe that to you, and it can be life-saving and important to take those allergy shots if you're severely affected. What can you do if you think you're bothered by those springtime allergies? Well, if the pollen's heavy and you're wiping the pollen off of your dark car, probably close the windows, stay indoors with the windows shut, and run your air conditioning. If you go outside, cool compresses on your eyes if they're itching. Try over-the-counter eye drops that contain antihistamines. Try over-the-counter antihistamines, which are now readily available. Try to pick one that makes you less drowsy. Be certain not to drive after taking the first dose until you determine whether this will make you sleepy. And then finally, sleeping in an environment where you do not have the pollen continually bathing into your nasal mucosa. Breathing into here, the nasal mucosa stimulated by the allergen will cause release of chemical mediators to lead to the other symptoms of the itching, sneezing, and coughing. This has been your apple per day. Thanks for joining me. Stay healthy.